What if I told you that the vitamin you're taking to protect your brain could actually be setting you up for a stroke? As a brain doctor, I've seen countless patients rushed into the ER, their lives forever changed in an instant. Not because of poor lifestyle choices, but because of a seemingly innocent supplement they thought was keeping them healthy. It's a silent threat that's been hiding in plain sight, and it's time to expose the truth. Every day, millions of older adults reach for vitamin supplements, hoping to protect their health. But what no one tells you is this: taking the wrong vitamins or the wrong dose could slowly destroy your nerves, damage your organs, or even kill you. A 2022 report from the National Institutes of Health, NIH, revealed a shocking truth. Over 30% of seniors take high-dose supplements they don't actually need. The result? A dangerous buildup of toxicity in the body, often without symptoms until it's too late. According to CDC poison control data, thousands of vitamin overdose cases are reported every year, and many involve older adults already dealing with chronic health conditions. One of the most alarming examples is vitamin B6. In high doses, it's been linked to irreversible nerve damage, causing numbness, loss of balance, and permanent neurological impairment. Imagine going to bed feeling fine, only to wake up unable to speak or move half your body. This nightmare scenario is becoming all too common, especially for those over 60. But here's the kicker: it's not always due to the usual suspects, like high blood pressure or cholesterol. Instead, it could be linked to something you're deliberately putting into your body every single day, thinking you're doing the right thing for your health. In this video, I'm going to reveal the shocking connection between a common vitamin and increased stroke risk that's sending shockwaves through the medical community. I'll walk you through the 4 vitamins that could be quietly putting your brain in danger, especially during those vulnerable early morning hours. If you or someone you love takes supplements, this information could quite literally save a life. Are you ready to uncover the truth about the vitamins in your medicine cabinet?
As a brain doctor, I've seen my share of unexpected dangers lurking in places we least expect. But nothing caught me off guard, quite like the recent cases involving a vitamin that many seniors take religiously, believing it's helping their brain health, only to find it might be silently increasing their stroke risk overnight. It sounds unbelievable, right? Vitamins are supposed to protect us, especially as we age. But sometimes what seems helpful can turn into a hidden danger. Let me tell you about this alarming reality. It's not about the usual culprits we all know: high blood pressure, high cholesterol, or diabetes. No, this risk comes from something far more surprising: a vitamin that's often recommended to support cognition and memory, yet, if taken improperly, can tip the scales toward a devastating stroke. This is a wake-up call, especially for our seniors who rely on supplements as a safeguard for their brain health. I remember the exact moment this concern hit home in my clinic. Mrs. Eleanor Grant, a vibrant 72-year-old retiree, came in with sudden weakness on one side of her body and slurred speech. She was rushed to the hospital and diagnosed with an ischemic stroke. Her family was shocked. She had no history of hypertension, no diabetes, and maintained a balanced diet. So what happened? That's when we dug deeper into her lifestyle and medications and found she had recently started a high-dose vitamin regimen. Convinced it was the secret to keeping her mind sharp. This case wasn't isolated. I began noticing a pattern emerging among several seniors. They were taking certain vitamins, sometimes in doses far beyond recommended amounts, thinking more was better. But little did they know, these vitamins could be quietly increasing blood thickness, causing clots to form more easily, and setting the stage for a sudden stroke. Now, if that surprised you, just wait. This is exactly why I want to share this with you, not to scare you. but to empower you to take control of your brain health safely. We often hear about vitamins as miracle workers, boosting energy, enhancing memory, and staving off cognitive decline. And yes, some vitamins are essential for brain function, but the key word here is essential. Your body needs them in the right amounts. More isn't always better. In fact, too much of certain vitamins can have the opposite effect. They can interfere with your blood's natural balance, making it either too thick or too thin, both of which increase the risk of stroke. I know this sounds complicated, so let me break it down for you. Your blood needs to flow smoothly through your brain's vessels, delivering oxygen and nutrients. If it becomes too thick, it can form clots that block blood flow, causing ischemic strokes, the most common type. Conversely, if the blood becomes too thin, it can lead to bleeding in the brain, known as hemorrhagic stroke. Both scenarios are dangerous, and both can be influenced by vitamin levels. Why are seniors particularly vulnerable? Well, as we age, our bodies process nutrients differently. Kidney and liver function may decline, affecting how vitamins are metabolized. Also, many seniors take multiple medications, including blood thinners, which can interact negatively with supplements. Without proper medical supervision, this cocktail can be a recipe for disaster. Here's where the problem gets more complicated. Many seniors don't tell their doctors about the supplements they're taking. They assume vitamins are harmless, so they skip mentioning them during appointments. But as a physician, I need the full picture to provide safe, effective care. That's why I always ask my patients specifically about supplements. It's a conversation I urge you to have with your healthcare provider, too. I want to pause here and share a story that really hit me. Mr. James Carter, a 68-year-old retired teacher, came in with sudden dizziness and weakness on his right side. He was diagnosed with a stroke, and when we reviewed his history, we found he had started taking high doses of a particular vitamin supplement just weeks before. He told me, "Doc, I thought vitamins were supposed to help me, not harm my brain." This fast. His frustration was palpable, and I understood it completely. James's case taught me a vital lesson. Even well-intentioned actions can have dangerous consequences if not guided by medical advice. It also highlighted the urgent need for awareness. Seniors must know that supplements are not risk-free, especially when taken without supervision. So, which vitamin is at the center of this hidden danger? I'll get to that in the next part, but before we move on, I want to emphasize something crucial. If you or a loved one is taking any vitamin supplements, especially in high doses or multiple types, please take a moment to ask, am I doing this safely? Have I discussed this with my doctor? Are my doses appropriate for my age and health conditions? Many of you might be thinking, I've been taking vitamins for years and never had a problem. That's great, and I'm glad to hear it. But the risk can increase suddenly, sometimes overnight, especially if new supplements are added or doses changed without guidance. Stroke is a medical emergency, and prevention is the best defense. Let me also address the broader issue here. The wellness market is booming, and vitamins are marketed aggressively as brain boosters. But the science behind supplement safety, especially in seniors, isn't always straightforward. Unlike prescription medications, vitamins often lack strict dosing guidelines tailored to older adults. This leaves room for harmful overuse. That's why it's so important to rely on trusted medical advice rather than marketing claims. Your brain health is too precious to gamble with. After all, strokes can lead to permanent disabilities or worse. And that's what worries me most. Our seniors are unknowingly putting themselves in danger by trusting supplements blindly. Asterisk. I just wanted to warn you because knowledge is power. Recognizing that even a simple vitamin can pose risks is the first step in protecting yourself. It's about balance, moderation, and professional guidance. Now, before we dive into which vitamin exactly raises stroke risk and how it does so, Think about your current supplement routine. Are you taking any vitamins daily? How much have you checked with your healthcare provider recently? If you're unsure, it's never too late to start that conversation in the next segment. I'll reveal the vitamin that's been flying under the radar, causing real harm when misused. I'll explain how it affects your blood and brain, and share real patient stories that underscore the urgency of this issue. For now, take a moment to reflect on what you've just heard. Stroke risk isn't just about the usual suspects. Sometimes it hides in the supplements we trust the most. And as a brain doctor who's seen the consequences firsthand, I urge you to take care, stay informed, and never hesitate to ask questions about your health choices. Remember, your brain deserves the best protection, not just from disease, but from well-meaning mistakes. Stay tuned. The next part will open your eyes to a vitamin that's been quietly raising stroke risk overnight in seniors. And I promise, once you know, you'll be better equipped to safeguard your brain health now. Let's talk about the vitamin that's been quietly raising stroke risk overnight in seniors: vitamin B12. Yes, you heard me right. Vitamin B12, often hailed as the brain's best friend, can become a hidden danger when taken improperly. It sounds ironic, doesn't it? It's the very vitamin we associate with boosting memory and energy. It might actually increase your stroke risk if you're not careful. Vitamin B12 is essential for nerve function, red blood cell production, and DNA synthesis. That's why doctors often recommend it for seniors who may have trouble absorbing it from food. But here's the catch: taking high doses of B12 supplements without medical supervision can backfire in ways many don't expect. Let me tell you about Mr. James Carter again, whose story I mentioned earlier. James started taking high-dose B12 supplements after reading about their supposed brain benefits. Within weeks, he began experiencing unusual symptoms, slight numbness, and then suddenly, a stroke. His blood tests revealed elevated levels of homocysteine, a substance linked to increased blood viscosity and clotting. Homocysteine is an amino acid in the blood that, when elevated, can damage blood vessels and promote clot formation. Normally, vitamin B12 helps break down homocysteine, keeping levels in check. But paradoxically, excessive B12 supplementation can sometimes disrupt this balance, especially if taken alongside other supplements or medications. This imbalance can thicken the blood and increase the risk of clotting, setting the stage for ischemic strokes. James told me, "Doc, I was trying to protect my brain with B12, but I ended up in the hospital with a stroke. I had no idea this could happen." And that's exactly the problem. Most seniors trust that more vitamins mean better health. But when it comes to B12, too much can cause your blood to behave like molasses instead of flowing freely. Now, you might wonder, how common is this? Isn't B12 deficiency more of a problem in seniors? That's true. Deficiency is widespread, especially because absorption decreases with age. But the danger lies in self-medicating with high doses without checking levels through blood tests or consulting a doctor. Some people take megadoses of B12 injections or pills, believing it will boost their brain power overnight. Unfortunately, this can backfire spectacularly. In fact, I've had several patients like James who started B12 supplements on their own or based on advice from well-meaning friends or online sources. They didn't realize that the timing, dosage, and combination with other nutrients matter a great deal. For example, taking high-dose B12 without adequate folate or vitamin B6 can lead to elevated homocysteine, increasing stroke risk. But it's not just about homocysteine. Excessive B12 can also alter blood viscosity by increasing red blood cell production beyond normal levels. When your blood becomes thicker, it's more likely to form clots that block arteries in the brain. This is especially risky for seniors, who may already have narrowed blood vessels due to age-related changes. James's case was a wake-up call. After his stroke, we carefully monitored his vitamin levels and adjusted his supplements under medical supervision. With the right balance, his homocysteine levels normalized, and he began a rehabilitation program to regain strength. His story underscores a critical lesson. Vitamin B12 is not a harmless supplement to take without guidance. I want to stress this point because many of you may be taking B12 supplements right now. Are you sure your dosage is safe? You're monitoring your blood levels regularly. If not, it's time to have a serious talk with your healthcare provider. Here's another important aspect. B12 supplements come in various forms: oral tablets, sublingual drops, injections. Each has different absorption rates and effects. For seniors with absorption issues, injections might be necessary, but only under strict medical supervision. Self-administering high-dose injections at home can be dangerous. You might ask, but isn't B12 water-soluble? Doesn't the body just flush out the excess? That's a common belief, but it's only partially true. While B12 is water-soluble, very high doses can accumulate in the liver and alter metabolic pathways. This can lead to unintended effects like elevated homocysteine or changes in blood cell counts. I've also seen cases where seniors combined B12 with other supplements like iron or folic acid without medical advice, leading to unpredictable interactions. For example, excess iron can catalyze oxidative stress, damaging blood vessels and increasing stroke risk. So, it's not just the vitamin alone, but how it interacts with your entire supplement and medication regimen. Let me share another story. Mrs. Patricia Lee, 75-year-old woman who came to me for memory issues. She was taking high doses of B12, convinced it would help. But her labs showed elevated homocysteine and thickened blood. We worked together to adjust her supplements, added folate and B6, and reduced her B12 dose. Over months, her blood markers improved, and her stroke risk decreased. Patricia said to me, "I thought I was doing everything right, but I didn't realize the balance mattered so much." Her experience is a powerful reminder that vitamins don't work in isolation. Our bodies are complex systems, and messing with one part can affect others. So, what's the takeaway here? Vitamin B12 is vital for brain health, but only in the right amounts and balance. Taking it blindly, especially in high doses, can increase blood thickness, promote clotting, and raise stroke risk overnight. For seniors, this is a very real and dangerous hidden danger. I just wanted to warn you because I've seen too many cases like James and Patricia's. If you're considering B12 supplements or already taking them, please don't do it alone. Consult your doctor, get your blood tested, and follow personalized recommendations. Now, you might be wondering what safe levels look like or how to balance B12 with other nutrients. That's coming up in the next part, where I'll also discuss other vitamins that can impact stroke risk. But before we get there, take a moment to think about your vitamin B12 use. Are you sure it's helping or potentially harming your brain? Health. Remember, stroke can happen suddenly, and the risks from improper vitamin use are real. Your brain deserves careful, informed care, not guesswork or assumptions. Stay with me, because the next section will unravel more surprises about vitamins and stroke risk that every senior should know. For now, if you or someone you love is taking B12 supplements, please take care to monitor dosages and consult your healthcare provider regularly. I can't stress this enough. Vitamin B12 is a double-edged sword, and knowing how to use it safely is key to protecting your brain health. We'll continue soon with more insights that can help you navigate the complex world of supplements safely. Until then, keep asking questions, stay informed, and above all, take care of yourself. Now, let's shift gears and talk about another supplement that's often taken with the best intentions but can pose a serious stroke risk when overused: omega-3 fatty acids. You've probably heard about omega-3 south being great for brain health and heart protection, right? Well, yes, they have benefits. But like everything else, there's a hidden danger when the dosage goes too high. or when combined improperly with other medications. Take Mrs. Linda Gomez, a 74-year-old retired nurse, for example. Linda was proactive about her health, taking high doses of omega-3 supplements daily, convinced they would protect her brain and keep her memory sharp. She was also prescribed blood thinners after a minor heart condition, something common in seniors. For a while, everything seemed fine, but then one day, she suddenly developed a severe headache, weakness on one side, and confusion. She was rushed to the hospital with a hemorrhagic stroke bleeding inside her brain. When we reviewed her medications and supplements, it became clear that the combination of high-dose omega-3 and blood thinners had thinned her blood too much, increasing the risk of bleeding. Omega-3s South have blood-thinning properties, and while that can be beneficial in moderation, excessive amounts can tip the balance dangerously, leading to hemorrhagic strokes. This is a perfect example of why supplement use, especially in seniors, needs careful medical oversight. Omega-3 fatty acids, primarily found in fish oil, can reduce blood clotting by inhibiting platelet aggregation. In simpler terms, they make your blood less likely to clump together, which usually helps prevent clots that cause ischemic strokes. But if your blood becomes too thin, it can't clot properly when needed, increasing the chance of bleeding inside the brain. Linda's case is not unique. I've seen several seniors who, encouraged by advertising and wellness trends, take large doses of omega-3 supplements without telling their doctors. Sometimes they combine these with prescribed blood thinners like warfarin or aspirin, unaware of the compounded effects. This is why I always ask my patients about all supplements they take. Even natural products like omega-3 South can have powerful effects on your body, especially your blood. And when combined with other medications, the risks can escalate rapidly. Now, you might wonder, what's the safe amount of omega-3 for seniors? The answer isn't one size fits all. It depends on your overall health, medications, and risk factors. For some, a modest daily dose can support brain and heart health without increasing bleeding risk. For others, especially those on blood thinners, even small amounts can be risky. That's why communication with your healthcare provider is crucial. Never start or increase omega-3 supplements without medical advice, particularly if you're taking blood thinners or have a history of bleeding disorders. Let me highlight another important point. Omega-3 supplements vary widely in quality and concentration. Some over-the-counter products contain much higher doses than needed. And because supplements aren't regulated as strictly as medications, the actual content can differ from the label. This inconsistency adds another layer of risk, Linda told me. I thought I was doing everything right by taking omega-3 South for my brain, but I had no idea it could cause bleeding. Her story is a sobering reminder that even natural supplements can have serious side effects if you're considering omega-3 supplements or already taking them. Here are some warning signs to watch for. Unusual bruising, prolonged bleeding from cuts, frequent nosebleeds, or persistent headaches. These could indicate your blood is too thin and warrant immediate medical evaluation. What's even more concerning is that many seniors don't realize that combining multiple supplements can amplify risks. For example, omega-3 South combined with vitamin E garlic supplements or ginkgo biloba, known to have blood-thinning effects, can increase bleeding risk significantly. So, if you're on any medications or supplements that affect blood clotting, it's vital to have a healthcare professional review your regimen. I can't stress enough how dangerous it is to mix blood thinners and supplements without oversight, you might ask. But I want to protect my brain and heart. Should I stop taking omega-3 South altogether? Not necessarily. Omega-3 South do have proven benefits, especially in reducing inflammation and supporting cognitive function. The key is balance and personalization. For many seniors, moderate omega-3 intake through diet like eating fatty, Fish twice a week can provide benefits without the risks associated with high-dose supplements. Here's where education plays a huge role. I always encourage my patients to prioritize nutrients from natural foods whenever possible. Supplements can fill gaps but aren't a substitute for a balanced diet. Linda's recovery was challenging but hopeful. After her stroke, we adjusted her medications and supplements carefully, reducing omega-3 intake to a safe level and monitoring her blood closely. She underwent rehabilitation and made significant progress. Her experience taught her and me that well-meaning supplement use without medical guidance can have severe consequences. I want you to think about your own supplement routine right now. Are you taking omega-3 South or fish oil capsules? If so, do you know the dose? Have you told your doctor? Do you combine them with blood thinners or other supplements? These questions are critical because your answers could mean the difference between protecting your brain and putting it at risk. Remember, stroke risk isn't just about high blood pressure or cholesterol. Sometimes it's hidden in the supplements we trust the most. The line between benefit and harm with omega-3 South can be thin literally. I just wanted to warn you because I've seen firsthand how quickly things can go wrong. Taking care of senior health means understanding these hidden dangers and making informed choices. Next, we'll explore other vitamins and nutrients that can impact stroke risk some you might not expect. These lessons are crucial for anyone aiming to maintain brain health safely. For now, if you or a loved one takes omega-3 supplements, please take care to review your dosages and medication interactions with your healthcare provider. Don't wait for a warning sign like Linda's stroke to act. Your brain health is precious and deserves cautious, informed care. Stay tuned. The next part will uncover more hidden dangers linked to vitamin misuse and how to protect yourself. Until then, keep asking questions, stay informed, and above all, take care. Now, let's take a closer look at some other vitamins and nutrients that might not get as much attention but can quietly impact stroke risk when misuse: vitamin K and iron. These are nutrients many seniors might be taking or getting through diet, thinking they're doing their bodies a favor, but in reality, they can create hidden dangers if not managed properly. Vitamin K is essential for blood clotting. It helps your body form clots to stop bleeding when you get injured. That sounds good, right? But here's the catch. If you're taking blood thinners to prevent clots, which many seniors do to reduce stroke risk, vitamin K can interfere with these medications. This tug-of-war can make your blood either too thick or too thin, depending on how much vitamin K you consume. Throwing your stroke risk off balance? I had a patient, Mr. Robert Mills, 70-year-old man on warfarin, a common blood thinner. Robert loved leafy greens like kale and spinach because he thought they were healthy brain foods. But he was eating huge amounts daily. His warfarin doses couldn't keep up with the fluctuating vitamin K intake, and his blood tests showed unstable clotting levels. One day, this instability led to a transient ischemic attack, a mini-stroke that was a terrifying wake-up call. Robert told me, "I thought eating all these greens was helping me stay healthy, but I didn't realize it could mess with my medication so badly." His story highlights how vitamin-rich foods and supplements can complicate blood thinning therapy, making stroke prevention tricky. What's more, vitamin K supplements are sometimes taken without doctors' knowledge, thinking they'll improve bone health or heart function. But for seniors on anticoagulants, this can be a hidden danger, increasing the chance of clots or bleeding if not carefully managed. Now, let's talk about iron. Iron is vital for making red blood cells and carrying oxygen around the body. But too much iron can be harmful, especially in seniors. Excess iron can catalyze oxidative stress, damaging blood vessels and increasing inflammation. This vascular damage sets the stage for strokes by weakening artery walls and promoting plaque buildup. Mrs. Gloria Sanders, an 80-year-old woman, came to me with fatigue and mild memory problems. She had been taking iron supplements for years, without checking her levels because she assumed it was safe. Her blood tests revealed iron overload, a condition where excess iron deposits in organs and blood vessels, causing damage. Gloria was unaware that her loose iron supplements could be worsening her vascular health and increasing her stroke risk. After adjusting her iron intake and starting treatment to reduce overload, her symptoms began improving. Iron overload isn't a common problem, but it's an important reminder that supplements aren't risk-free. Even essential nutrients like iron can cause harm if taken unnecessarily or in excess. Both vitamin K and iron examples show a critical truth. More is not always better, and balance is everything. Seniors often think that piling on supplements will boost their health. But without medical guidance, this can tip the delicate balance in the body, leading to unexpected and dangerous outcomes. I also want to mention that supplements aren't the only source of these nutrients. Diet plays a big role, and some foods are extremely rich in vitamin K or iron. So, it's not just about supplements. It's about the total intake and how it interacts with your health conditions and medications. If you're on blood thinners or other medications, it's essential to keep your healthcare provider informed about your diet and supplements. This way, your treatment plan can be adjusted to maintain the right balance and keep your stroke risk low. You might ask, how can I tell if my supplement routine is safe? The answer is regular monitoring. Blood tests can check vitamin K status, iron levels, and clotting times, giving your doctor the information needed to adjust medications or recommend changes in diet and supplements. Also, be cautious about combining supplements. For example, vitamin K can interfere with blood thinners, while iron can worsen oxidative stress. Taking multiple supplements without supervision increases the chance of harmful interactions. Mrs. Gloria Sanders said to me, I thought I was doing everything right by taking vitamins, but I didn't realize I was putting myself at risk. Her words echo what I hear so often from seniors who learn the hard way that supplements can be double-edged swords. This is why I urge all seniors and caregivers to approach supplements with caution. Don't assume they're harmless just because they're natural. Instead, think of them as powerful agents that need respect, knowledge, and professional guidance. We're not saying avoid vitamins like K or iron altogether. They're essential nutrients. But managing how much you get from which sources and in what combinations is key to protecting your brain and vascular health. I just wanted to warn you because too many seniors are unknowingly piling on supplements that could do more harm than good. The balance between nutrition and medication is delicate, and without care, it can be tipped toward serious risks. Take a moment now to review your supplement list. Are you taking vitamin K or iron? Do you know the doses? Talked to your doctor about how they fit with your medications and diet? If not, this is the time to start that conversation in the next part. We'll talk about safe alternatives and nutritional advice that can help you maintain brain health without risking your stroke safety. For now, remember, supplements are tools, not cures, and they must be used wisely. Your brain and your heart depend on balance, knowledge, and careful choices. Stay with me as we continue this journey to uncover the truth behind vitamins and stroke risk, and how you can take control of your health safely. Now, after uncovering these hidden dangers in vitamin and supplement use, it's time to shift our focus to solution-safe alternatives and nutritional advice that can help you protect your brain health without raising your stroke risk. One of the most powerful lessons I've learned from my patients is that a balanced diet rich in natural foods often provides the nutrients your body needs more safely than supplements. Mrs. Helen Thompson, 77-year-old retired librarian, is a perfect example. Helen had been taking multiple supplements for years, including high doses of B12, omega-3, and iron, hoping to boost her memory and energy. But after a scare involving unstable blood tests, she worked with her healthcare team to reduce her supplement intake and focus on whole foods. Helen's new diet included plenty of leafy greens, colorful vegetables, lean proteins, nuts, and fatty fish like salmon and mackerel. Within months, her blood levels stabilized, her vascular health improved, and she reported feeling sharper and more energetic. She said to me, "I thought supplements were the answer, but eating well made all the difference." This story isn't unique. For seniors, getting nutrients from food helps maintain balance because natural foods contain vitamins and minerals in combinations, in amounts that the body can handle more effectively. Plus, whole foods provide fiber, antioxidants, and other compounds that support brain and heart health, which supplements alone can't replicate. So, what does a brain-healthy diet look like? It's often similar to the Mediterranean diet, which emphasizes fruits, vegetables, whole grains, nuts, olive oil, and moderate consumption of fish and poultry. This diet is rich in antioxidants and anti-inflammatory nutrients, which help protect blood vessels and keep blood flow smooth, key factors in reducing stroke risk. You might be wondering about protein sources. Lean meats, beans, and legumes provide essential amino acids needed for brain function without the excessive iron that can come from red meat. Including a variety of plant-based proteins can also help maintain a balanced nutrient intake. Now regarding omega-3s. Rather than relying on high-dose supplements, aim to eat fatty fish 2 to 3 times a week. This natural approach delivers beneficial doses of omega-3 fatty acids, along with other nutrients that support overall health and reduce bleeding risks associated with supplements. When it comes to vitamin B12, foods like eggs, dairy, fortified cereals, and fish provide this essential nutrient naturally. For seniors with absorption issues, medical guidance is crucial if supplementation is needed, but it should be carefully monitored to prevent excess. Vitamin K, essential for blood clotting, is abundant in leafy greens and cruciferous vegetables. If you're on blood thinners, work closely with your healthcare provider to maintain a consistent intake rather than avoiding these foods. Altogether, iron can be found in moderate amounts in lean meats, beans, and spinach. Avoid excessive iron supplements unless prescribed and monitored by a doctor. I want to share another inspiring story. Mrs. Helen Thompson's journey shows that sometimes less is more. After scaling back supplements and embracing a nutrient-rich diet, she not only stabilized her blood markers, but also felt mentally clearer and physically stronger. Helen said to me, "I realize that my body works best when I nourish it naturally, not by piling on pills." Her success is a powerful reminder that good nutrition is foundational to brain and vascular health. Of course, I understand that changing diet habits isn't always easy, especially for seniors who may face challenges like limited mobility, appetite changes, or access to fresh foods. That's why I encourage involving caregivers, family members, and healthcare teams to support these changes. In addition to diet, regular physical activity, adequate hydration, and managing stress are equally important for brain health and stroke prevention. Supplements can never replace these lifestyle factors. I also want to emphasize the importance of regular medical checkups. Blood tests to monitor vitamin levels, clotting status, and overall health are vital to tailor both diet and supplement plans safely. If you're currently taking supplements, don't stop abruptly. Instead, discuss with your healthcare provider about which supplements are necessary, safe doses, and how to integrate them with your diet and medications. I just wanted to warn you because many seniors believe supplements are harmless and may not realize the risks until it's too late. But with proper guidance and focus on natural nutrition, you can protect your brain health effectively. Remember, your body is a complex system that thrives on balance. Supplements can be helpful tools, but they aren't magic bullets. Prioritizing nutrient-rich foods and safe practices will always serve you better in the long run. Finally, I encourage you to stay connected with trusted health resources like Health 365, where we provide ongoing insights, support, and practical advice tailored for seniors. Knowledge is your best ally in preventing stroke and maintaining brain health. Take care, ask questions, and never hesitate to seek professional medical advice about your vitamins, supplements, and overall health plan. Your brain deserves nothing less than the best care. We've covered a lot in these chapters: vitamin B12's hidden dangers, omega-A23 risks, the impact of vitamin K and iron, and now the importance of natural nutrition and safe supplementation. With this knowledge, you're better equipped to make informed decisions. Stay vigilant, stay informed, and together, we can work toward healthier, safer aging for you and your loved ones.